So one of the hopes that we have in the field of addiction treatment is using brain stimulation, right? And different brain stimulation technologies. We have TMS, we have different sort of interventions with focus ultrasound, deep brain stimulation, different sort of brain stimulation technology. And specifically in the field of addiction, people are working in the field with kind of lots of efforts. The field is growing over the time. And in the field of addiction, we already have over 242 trials that people try to test electrical stimulation or magnetic stimulation in different substances. As you can see here, nicotine is the most frequent, then alcohol, then amphetamine. And the field is just growing over time. This is by the end of 2024. So the field is significantly growing over time. And if you put all those studies together, overall, with electrical stimulation, the blue is electrical stimulation, and this is electrical stimulation, the red one, and blue is TMS. As you can see here, overall, there is a significant effect of a stimulation on both craving and consumption, okay? So the meta-analysis is significant. The effect size is a little bit larger for TMS compared to electrical stimulation, and it's a bit larger on craving compared to consumption, okay? But overall effect is there. But the challenging in the field is, what is the challenge as you can see here? People have targeted all around the brain. So these studies are targeting different, so you cannot put them together and say, okay, it is working. What is working? I mean, what is the target that is actually working? So that is one of the major challenges in the field. And even when you go to the details of those studies, for example, when you go to those studies that targeted DLPFC, and many of them, they target DLPFC. But when you go to the details of DLPFC studies, you can see the way that they define DLPFC. They use very different ways of defining DLPFC. Some of them, they use 5 centimeter rule, the other 6 centimeter rules. So there is no convergence in the field. And meanwhile, there is a hope that we might be able to improve targeting and finding the better targets. Traditionally, in the field of depression and in the field of addiction as well, we have been just using the skull-based measures or EEG-based measures. But now, which is not very accurate, which is not very precise, and over time, we are adding anatomical targeting. But also now we are using fMRI or PET imaging to actually find the right target and finding the right network. And eventually, we are moving towards doing that in a personalized way. So for each individual person, finding the right target and doing the right targeting, okay? So that is the main thing that we are working on. And the next 30 minutes, I'm gonna give you all the details of what is happening in the field of individualized targeting of brain circuits using electrical and magnetic stimulation and being able to use that in addiction treatment, okay? So that is then a state-of-art overview of what is happening and how you can be a part of that movement and being one of the scholars in the field in the future. One of the challenges that we have in the field of depression, we almost know that potentially the best marker that is working now for using TMS for the field of depression is a specific connection between dorsolateral prefrontal cortex and subgenual cortex. So, and there are even some companies that they started to patent the way that you can measure these connectivities. And there are now multiple different patents in the field in terms of how to measure that specific connectivity. But in the field of addiction, it's not very clear in terms of what would be the right circuit to target among different circuits that we have in the field. And that is what we are working on in terms of what would be the right circuit. And it seems that there are multiple circuits involved in the field of addiction. We all know that, and that makes things complex. So one of the models that we are interested to is what we call kind of the interaction between executive control network or ECN and default mode network. And it seems that when people are in the state of craving, default mode network is further activated. Executive control network that gives you control is just less activated. And when you go to the control state, you can manage your craving, the executive control network would be dominated, okay? So that is the craving state, that is the control state. And this sort of model gives us lots of nodes and targets to use. How we can, for example, there are different ways of approaching this system, right? And that is the way that I'm hopeful that we can kind of find different targets. But what is going to be the best way of doing that? So one of the networks that we are interested is targeting this area, which is called ventromedial prefrontal cortex or frontopolar cortex here, which is close to what Mark was mentioning in terms of the infralimbic cortex and areas that we have in rodent models. And interestingly, like what Mark mentioned in terms of that is connected to nucleus accumbens shell, we have the same sort of connection from here to nucleus accumbens in fMRI, in drug Q-reactivity. I will show you some of the results of. So that is one of the areas that we are interested to. And using fMRI drug Q-reactivity as a targeting biomarker, targeting is a new dimension, using that for targeting. And to be able to do that, for example, we wanted to go from frontopolar cortex and tap into amygdala and nucleus accumbens, and do that in an individualized way in a group of 60 people with methamphetamine use disorder. Each of these dots is one patient with methamphetamine use disorder. And they are distributed across this three-dimensional space, X, Y, and Z. And this is the space, as you can see here. And each of those dots are the optimum target for being able to have access to amygdala from frontopolar cortex, okay? And this is how we do that in an individualized way. Ghazal, postdoc in the lab, fantastic postdoc, brilliant postdoc, she has been instrumental for putting that together. And we showed that specific individualized target, the level of connection in individual targets is related to the level of craving that people are experiencing. And not only optimizing the location, but even the orientation of the coil, whether we put the coil in different orientation is going to be important in terms of how you can engage that network. And also, we started even to use robotic arms to be able to optimize the right way of doing that. And also we realized that we need to optimize the dose of a stimulation as well, because dose is also important to just make sure that you can do that in the right way. And we put that in a paper, is already available, and you can kind of see the pipeline. Everything is already there. And it is already on a GitHub page. So if you go to that GitHub page, the pipeline is already there. Ghazali did a really nice job in organizing that in a GUI, and you can just go and just follow the pipeline. So it is kind of an open access platform that you can use it. And we also provide all the fMRI tasks that we have. And now we are publishing some of the databases that can be a reference point for others who are going to. So they are all open access platforms. Yeah, we discussed that in a paper that's published in American Journal of Psychiatry about how frontopolar cortex is important for that. If you are interested, you can go and read that paper. There are lots of interesting kind of things about that specific targeting. But meanwhile, when we discuss about those networks, one of the other areas that are interesting is another network. The green network, which gives you control. And you want to activate nodes of these networks and make them connected. And to be able to do that, we are using a technology called frontoparietal synchronization, which is a pretty non-expensive technology that we oscillate two nodes of the network together from outside, and then they start to oscillate together, and then two nodes oscillate together, they get connected to each other. And you can increase the synchronization and connectivity between these two nodes. And we develop a specific pipeline to be able to optimize that for patients with substance use disorder. And this is the way that it looks like in the lab in terms of we do that inside a scanner while we are doing imaging and do the stimulation inside the scanner. And we have some initial results that doing that frontoparietal stimulation, first of all, can engage this is the stimulation in the right frontoparietal cortex, as you can see here. We have been able to engage that frontoparietal network on the right side that we have been doing the stimulation. Even on the left side, you can see some levels of engagement. And then that network is acting as something like a top-down suppression of subcortical areas like nucleus accumbens, ventral striatum, which includes nucleus accumbens and kind of a part of the head of the caudate, and also amygdala. So we can do some like a top-down suppression of the network. And to be able to improve the quality of these sort of electrical stimulation inside the scanner, we invited all those people who are doing fMRI and electrical stimulation at the same time, because that gives you some opportunities. So you can do the stimulation inside the scanner and see what is actually happening while you are recording and you're stimulating and you're recording. So it's called concurrent electrical stimulation inside the fMRI. And that is something that is technically doable. I'm really happy to help Eduardo to just set up that in his lab here. It's not very hard to do, but there are lots of nuances in terms of how to do that. So we ask everybody to just contribute to a methodological checklist in terms of how to do that in the best possible quality. And we developed a specific checklist for that, and that checklist is already available. So if you want to do this, you can use that specific methodological checklist that is available in the field.